Fun. Here. All right, welcome back to Someone Needs to Say It TV. I'm Emily and I'm here with Alex. Today we're going to be discussing the VA healthcare system. Let's go ahead and dive into what does the current VA system look like? Like, what have you ever used it?
Yeah. As a veteran, I have used it. I use it every year, actually. So the way that the VA system works now is we have hospitals just like anyone else would, and we have clinics and similar to your primary care physician's office. So when you get out of the military, you enroll with the VA, and so then they start basically taking you from TRICARE, the active duty service healthcare provider, and you enroll in the VA healthcare system. So I have a primary care physician, just like a regular doctor, who is a regular doctor. And I go to him for anything that I need. If I needed servicing illnesses or injuries or anything like that, I go to them. And then if they can't provide that level of healthcare, then they give me a referral to go see someone outside of the system. They also do have, there's a big hospital, Michael E. DeBakey, I believe is the name of it, is the big hospital that's in downtown Houston. It's right in the Med Center complex with all the big name hospitals. And so that's what it is here locally. But so when you get out of the military and you go into the civilian side, you would just basically transfer over into that program and have those services.
Okay, so what happens if like you get strep throat and you need to be seen immediately?
Okay, so they do have, so just like you could call and try to get an appointment, but getting an appointment might take a little bit of time to get in to see your primary care physician. So if you had an illness, like let's say you have strep throat or a flu or whatever, you could go into sick call at a local VA clinic, or you can go to the emergency room at a VA hospital and be seen. So you could go in there. It's called sick call, is what we call it in the military, and it's basically the same thing. You would just go to that VA clinic and be seen that day.
Okay, so it sounds
as well as sorry, I didn't mean to cut you off.
No, you're fine.
But also like if you have mental health, a mental health problem going on or need to be seen immediately, they have telehealth stuff. And they have at least at the facility that I go to in Texas City, they have a behavioral health branch, and where you can be seen that day.
Okay, so that really wraps up what questions I had about what wait times. What about the why does it have such a bad rap? Why are there so many people complaining about the VA?
So those two things actually kind of go hand in hand. So you had mentioned the wait time. So
yes.
Okay. If you have, let's say you have an injury and you need to be seen by the doctor, or you wanted to get in to see your PCM, your primary care physician, or
PCP,
primary care physician, PCM, primary care, whatever that is. But anyways, regardless, sometimes there is a little bit of a wait. But so if I schedule an appointment, it might be 2, 3, 4 weeks. The longest I've ever had to wait was like 5 or 6 weeks.
But this isn't for this excludes if you have a sickness,
if you have a sickness, you can go in right then. You can go right then.
Okay, so that answers my question.
Well, but so let's say, but you want to get in there to talk to your specific doctor, the doctor that you actually work with every year, and so. Part of that is that every year I go in annually, every single year, right around the August timeframe is when I go and see my PCM or PCP every year. And so before a week or 2 weeks before I go in for that appointment, I'll go in and do my blood work, get my blood drawn, so that when I go in there and to see my doctor every year annually, I'll already have my labs is what it's called. I'll already have that done. So when I go in to see my doctor, he can go through total review of all of my stuff. Anything that might pop up is a change from last year or whatever, all comes up in that thing. So with that's the only thing that I can see to relate with, that people talk about the long wait times and stuff. And I just personally haven't seen it.
Yeah, a lot of people are saying they think the VA is a joke.
Yeah, and I can't get on board with that. Yeah, you wait a little bit longer, but when everybody wants to talk about overseas or Canada or Europe or whatever, I'm sorry, but if you actually have gone to one of those places or talked to someone that lives there, it's very similar to what the VA has, the timelines the VA has. And I know in years past they did have some problems, but regardless of who you voted for, if you voted for Trump or you didn't vote for Trump, the last time Trump was in office, he made or created a program called the Veterans Choice Program. And that Veterans Choice Program allows you to go see a civilian provider rather than a VA provider.
Okay. That's
so
nice.
like we have multiple options, and the system's not perfect, but it's something.
Yeah.
And it's
everything can
and we have to start somewhere. So, I mean, if we can make improvements off of what we have in place with what so far, I mean, just that Veterans Choice Program was a huge advancement, in my opinion, because you don't have to just go see the Veterans Affairs doctor. You can go to the Veterans Choice Program and go see someone locally that you want.
So what really is the difference between a civilian doctor and a VA doctor? Like,
there's really not much of a difference at all. And when you're in the military, those are most of the time, which there are civilian doctors, but there are military doctors. So doctors that are actually in the military, that are active duty service, actual doctors that are actually in the Army or the Navy or whatever. Once you get out and you're on the civilian side, the VA, most of those doctors that work for the VA, which not all of them, but a lot of them, especially specialists, are civilian practice doctors that just go and also work at the VA. So they might work at the VA a certain amount of days or a certain amount of hours or certain weeks out of the year or whatever. For instance, I had my wisdom teeth pulled. Well, that doctor was in his 60s at that time, and he had his own civilian practice. It was outside of Fort Hood. Had his own civilian practice, and would do part-time basically in the military, but was a lieutenant colonel in the or actually he just got promoted to a full bird colonel in the military. So he was still a civilian doctor, but he had that part-time national, I think it was National Guard, where he was still in the service for that time, but he just went and did his time there in the military, and then had his own civilian practice.
Oh, okay.
So there's not like, it's not like a half-rate doctor or something crazy like that. Sometimes people get like label these doctors as like half-rate or not real doctors. No, these are real doctors. And a lot of them are just civilians that go to work for the VA part-time, or even if they work for them full-time, they just have a different pay structure as what they would have if they had their own practice.
Moving on real quick, how do you feel being called stolen valor, basically?
Oh, that guy from the last week, said that I hadn't been in the military or something like that. How does that make
you feel?
I was in the military for 10 years.
Yeah.
I just happened to do my part, and I'm not knocking it. Hey, I know some people have bad experiences with the VA. I can't speak to your individual situations, what you went through, but I will tell you that from my own perspective and what I've seen and friends that I've helped through the system as they've transitioned from the military to out, I did my homework. I put in my time before I got out of the military. I submitted all my documents to the VA. So I had my packet ready to go as soon as I got out, and I actually had hernia surgery like 6 weeks after I got out of the military. I had umbilical hernia surgery through the VA. Wasn't at a VA hospital.
And did you run into any
I didn't
problems?
No, not at all. No, not at all. I was instantly within days of me getting out of the military, I was in contact with the VA. The VA, I went in, saw them, my primary care physician sent a referral in. So they sent me down to the big hospital downtown in Michael E. DeBakey. And I went down there. They checked me out. Said, okay, this is what we're going to do. We're going to set you up with a provider. And then I got it done somewhere right off the Beltway by like Blackhawk and Beamer or something like that.
So you had an overall good experience.
Yeah, 100%. They set me up with an outpatient clinic that's where I had my surgery done. I don't know who my doctor was that did my surgery. I went in there. It was an outpatient clinic, just like if you were going to go do it as a civilian, a regular civilian. I've taken my mom to multiple surgeries that she's had, and it was the same exact process. I didn't pay $1. Nothing happened.
No copay, nothing?
Nothing, because you got that referral because you went through the process.
Interesting.
If you go to the VA, you talk to your PCP, and they set you up with a referral to see a specialist, and that specialist performs surgery or whatever medical service they're gonna provide for you. It's paid for by the VA. I didn't pay a dime for any of that. I didn't even pay anything for my medical or my medications. I went back to the VA hospital and picked up my prescriptions at the pharmacy at the first floor at the hospital, and it was 100% free.
That's crazy. And I mean,
It's wild.
why do you think people are complaining about it then?
I hate to
what
say
could
this,
they be complaining about?
but I know that there are some places that aren't the same as others. So hopefully,
like different states.
right, different locations.
Does the government leave it up to the states to take care of their veterans, or is it a federal?
They're federal programs. The VA is a federal program.
So it's not like abortion where it's led up to the states.
No, not at all. Not at all. Not at all.
All right.
No, so it's a federal program across the United States, and they also have locations in other countries as well.
Yeah.
Overseas in the Puerto Rico, things like that. They've got veterans affairs locations all over the world. But so I'm going to be speculating here. So let me just preface this by saying this. I know that all places aren't going to be the same.
Yeah.
However, I think that there's a lot that we can do as individuals to help the process along.
Absolutely.
I mean, I'm just going to be brutally honest and speak my piece and just say that, hey, like if you submit your documents and you set an appointment with your doctor and you follow up and you
show up to that appointment,
and then you show up to it.
A lot of people don't show up. And that takes time out of the doctor's day.
Wasted time.
And the doctor's just sitting there twiddling his thumbs when he could be taking care of a patient.
Straight up.
Please show up to your appointments.
Right.
I mean,
like the amount of missed appointments in the military, because that's when they could actually track it. It was disgusting. And anybody that's been in recent years can relate to this, because I'm sure that they sat in a briefing with their first sergeant or their commander and they talked about missed appointments. And it's gotten to the point where it's like the post commander is looking at, hey, why are these guys? It's become such a problem. Because think about it. If you're wasting that time, you're wasting those slots where not only are you missing out on that service, but somebody else could be seen in your place. Yeah. So if it was going to take 6 weeks for you to have
together as a country,
straight up,
like we really
straight up. If it was going to take 6 weeks to get an appointment, but all these people are missing appointments, maybe that could be shrunk down to 3 weeks or 4 weeks or 2 weeks. I don't know. I'm just speculating, but I think there's a lot that we can do as individuals to speed the process up and to make it better. But also, this isn't a perfect system. No. It needs to be,
and that
to
was
grow.
My next question was, do you feel like we need improvement in the VA healthcare system? As,
for sure.
You know, a veteran who goes
I
do you see room for improvement? And do you think that it should be more like Europe's system?
Well, that's two questions on that one. So first, let's address the first part of that. Yes, I do think there's things that they can improve on.
Okay.
I think that it's a great program to start foundationally. Mm-hmm. I think that there's 100% things that can be done to fix it or to improve it, which that's over the past couple of years, for the first time in many, many years, we actually saw them talking about it. Like I said, President Trump put out the Veterans Choice Program, which allowed for you to not have to go to the actual VA hospital, VA clinic to be treated. You could go to a civilian doctor and receive treatment paid for by the government just the same way.
I think that's great.
That's an improvement, right? So there are eyes looking at it, but this is something that we should all get involved in. Like, let's give feedback. Let's talk to them. Let's give them advice instead of bashing everything and saying, "Oh, this is garbage. This is trash." Why don't we give some advice about how we could improve it, how we can make it better, what things would help make it better? Because it is a system that's servicing a lot of people that isn't perfect, and it's underfunded. Like we should, if we had something, and that's what in our previous episode where we talked about military service, if we had something where we could push the amount of people through the system to keep the system fully stocked all the time, and then we made this a national program because it was a nationwide public or a military service or civilian core services that we all pay into by doing our 4 years of enlistment. You could grow this program to be a national program where you aren't just doing something like Europe. The second question that you asked, everybody says that everything's free in Europe and Canada. No, that's not true at all.
There's no such thing as free.
Not at all, and not even on a sarcastic level. Europe and most of the countries in Europe have hugely big tax deductions that are paying for those things. Yeah. So these guys are getting paid, or taking 40%, 50%, 60%, 70% of federal taxes out of their paycheck to pay for these quote unquote free programs that everyone wants to compare the United States to. Can you imagine making $100,000 and the government pulling 70% or $70,000 out of their paycheck to pay for these social services, free college, free healthcare that are free, but they're not free at all. They're taking huge amounts of deductions. Even like France, they're like at 7%, 8% just for healthcare.
Yeah, 6.5% of taxable income.
Right. So actually look at the numbers and don't just take these clickbait headlines that everybody wants to refer to. Oh, Europe's better, Canada's better. Canada's tax rate is like 45%. Half of their money is going towards social services like healthcare, college, and then everybody wants to call it free. No, you're giving away half of your entire paycheck to have those free things. Well, what if you don't have a family? What if you're a single woman or a single man? You don't have kids, you don't have a husband or a wife, and you don't have kids. So you're getting taxed 50% of your entire income is going to federal government to pay for all those things. So someone else's kids can go to school. Someone else can get health care that's not even free. And guess what? Their wait times are very similar to what they have with the VA. So I think that if people would actually educate themselves and actually look at what these other programs entail, how much they cost,
the out-of-pocket costs. They're pretty high.
They're huge, and that's on top of the free healthcare that they supposedly get. And oh wait, have you ever been to a doctor where the doctor tells you, oh wait, your surgery isn't life or death, so guess what? You're going to have to wait. Americans would be up in arms with that. Yeah. That's how it works in a lot of those countries where it's free healthcare. No, well, it's priority healthcare. Meaning if you want to have a surgery or need to have a surgery, but if you could use it, it would be very beneficial to you, but there's someone that has a surgery that's
surgery.
Well, exactly. Or exactly. Or a knee surgery or a hip replacement. Yeah. Well, if somebody has to take precedence above you because they need a life or death surgery, they're bumping you. So you might have a surgery that you could get done. It's a routine surgery, isn't a big deal, but you have to wait 2 months, 3 months, 4 months because there's all these other things in front of you because your stuff isn't like life or death.
I know, but wouldn't helping the life or death situation be more beneficial?
I'm all about that.
Increase the overall well-being of the country.
No problem. But those are routine things that are going to happen all the time. We deal with them all the time here. Why is it that people can get routine surgeries and life or death surgeries here all the time, but all of a sudden over there, those things get bumped because those slots are filled by other things? Because this is the thing. There's only so many slots, and they're going to get filled with other priorities. If Americans were told, hey, we don't think your situation is that big of a deal, people would lose their minds.
You really think?
People would lose their minds if they said, oh, no, you might think that's important, but we don't categorize that as that important. So you're going to have to wait until we have time to deal with your
situation. What do y'all think? How do you guys feel about that? Do you think that you would not be so happy if you were told that you had to wait? Let us know in the comments what you think.
For sure.
But ultimately, another question, why do you think Taiwan is rated #1?
Well, okay, but that part of that goes back into mandatory military service. A lot of these countries that we had discussed earlier, you got to look at the foundation, the fundamentals of those programs. Do you have mandatory military service? A lot of those countries do. Yeah. And that's why part of those things can be fun. And I'm all about it. If everybody had the opportunity, like we had talked about the other day, to join the military service or a civilian program, like what we had identified, which I'm by no means am I saying that we had all the right answers.
No,
we just are putting some ideas out there that these are possible things. But if we had something like that in place, then hey, we could provide better healthcare.
Absolutely.
Beef up the system that we already have with the VA. Just using the VA as I don't care if we even scrap the whole idea, but using it as a fundamental, like, hey, we have something to work with. Let's see how we can fill and flow and move things around.
The VA would grow rapidly
100%.
And
100%.
More people would be able, it would be an all around.
Make it better.
Better system,
Instead of knocking it, actually come up with ways to help fix it or to make it better. And guess what? You don't have to get rid of all these other healthcares or all these other insurance providers at the same time. You could have a national program that provides very good service, But hey, a lot of people nowadays have insurance providers from their job,
Yeah.
or they went and bought their own on the outside. So they might have a primary insurance company and a secondary or a backup insurance provider. So let's say that your first insurance pays 80% or 70% or 50%. The secondary might pick up the rest of it, so then you don't have to pay anything, or maybe very little. There's nothing wrong with that. If you had a national program so that everybody could be seen.
Sometimes the secondary doesn't take.
Well, but that's a whole nother situation, a whole nother story. That's something
just from my personal experience,
right? But that's civilian healthcare. So so you have your own complaints about civilian healthcare.
I could go on
and on. But that's a whole other beast. So, but if we had a national program where the national was able to provide the basics and general healthcare for all, if you wanted to get even more better coverage, cool, get that on the back end.
Is that kind of like how Taiwan is? Then?
Yeah, very much so. But they also have mandatory enlistments and programs, but then they also tax their people, so it's not free.
Well, yeah.
So I think their tax rate's like 7% or something like that. 7% of GDP, I believe, actually.
We'll have to.
So you'd have to check the stats, but that's where that's 7% of GDP. Look at their GDP. That's billions and billions of dollars for a country that I don't know what their current population is, but it's in the double digit millions. So it's that's quite a bit of money for a smaller populace. We have that in one major city in the United States.
True.
So,
I feel like
no, it's very hard to compare apples and oranges countries without having those basic fundamental statistics laid out so that you can actually compare and contrast the two.
Yeah, no, definitely, most definitely. I think that there's always going to be room for improvement with anything. Dealing with the VA system, the healthcare system, all of it, it all needs improvement ultimately. I don't feel like I don't think it's as bad, really. It sounds like the VA isn't as bad as people are making it out to seem.
Man, I don't think so. My personal take, I don't think that it's as bad as but it used to, from what I've heard, it used to be a lot worse. But from my personal experience, I joined the military in 2005.
Yeah, give them a little bit of your
fresh
background.
Out of high school. I graduated early, shipped out to go to basic training early while everybody was just finishing up school. I was already on my way out the door to basic training. And so that's my life started right into the military.
What year was this?
2005.
Okay.
2005.
So this was right after like 9/11.
Yeah. This is in the surge time frame, the bodies and boots, the mass surge where they want to pump 400,000 people or whatever into Iraq and Afghanistan. Yes, that's when I joined, when it was mass inflow of people and where they were trying to push people in. So I joined 2005 and then I got out in 2015. So it's been almost I guess a decade now. But yeah, so that time frame, from what I've heard before that, the VA was not as good. But like I said, President Trump put the Veterans Choice Program in there, which I personally saw the benefits of that and how that stuff changed. I did. And I mean, that, like I said, my umbilical hernia surgery was seamless. Like it was flawless. Like the way they handled it, I did not pay $1, nothing. It was, I'm not trying to say that or knock the old times. Maybe it was worse then, but I feel like if people would give it a chance, and yeah, it's not perfect, but it's a pretty good program from what I've seen in my experience with it. And then also, like, if you go and you keep your appointments, if you do your annual healthcare, don't show up with stage 4 cancer. Show up every year and get your blood drawn. Go to your checkups. Do your
preventative services. Yeah,
so that you can catch it early on, where you might have stage 1 cancer or your levels being off. So they can get. I'm pretty sure, I'm not a doctor, but I'm pretty sure most doctors would rather see you and see the differences in your levels change before they had to measure the size of your tumor growth.
Yeah, absolutely.
So I'm just saying, but from my personal experience, the VA has been good to me. It's not perfect. Yes, I wait a couple of weeks to go to my doctor's appointments, but if I needed to go see a doctor, I could go in there to sit call any day of the week.
Okay.
Or I could go to the hospital downtown. But I've actually been to civilian hospitals 2 or 3 times, I think 3, But one time I called beforehand, and they said, just go into the hospital. Well, is when I had COVID.
Yeah.
They said, just go into the hospital. Don't worry about it. We'll deal with your prior authorization. And that's where when the lady informed me that I didn't actually have to have a prior authorization to go to the doctor. I just needed to call them and inform them about it on the back end so there wouldn't be any issues with payment.
Okay.
So the other time that I went, no, it's been 3 times total. The other times that I went, I called after the fact, and I've never received a bill at all. I've actually received a statement of benefits showing that the VA had paid them, and this is what that payment would have cost.
Yeah, what it was. Wow.
So I mean, if you allow the system to work for you and do your part, I can't knock them. I really can. I mean,
that's what it sounds like.
I know that everybody that hasn't had that same experience, but from the buddies that I still talk to from the military, I think that guys and gals are getting pretty good service, pretty good healthcare, given the funding that they have now and the ability to give us what they have funding for. So.
What do you think about the people that don't live in big cities, that don't have access to the VA?
That's a kicker.
Everywhere. What about that?
Right.
Do you think that's where they're coming from?
Possibly, and that's why when we were talking about it earlier, I was like, man, so I don't want to use my situation as a end all be all. Right. So
we're like the third, fourth largest city.
Exactly,
in
and we have a big hospital downtown, and we have a clinic that's right by our house. So, and that's what I was gonna get. I just kind of got off topic. But that might be where they're coming from. Where, like, let's say you live in Oklahoma in the middle of nowhere, and the closest hospital is in Tulsa, Oklahoma. That could be where you have a little bit of discrepancies. However, with the Veterans Choice Program,
you can go to any doctor.
You can. And so I would venture to say that if you're having problems, guys, and that's one of the things that we wanted to talk about or get people talking about is, hey, let's give each other advice. Let's figure out how we can work through these issues so that we can help each other. Like, from a veteran to other veterans, like, hey, if I can help give y'all some information on how to navigate the system or how to make sure that you prepare yourself getting out of the military or whatever, drop a question or a comment into the comment section, and I will get back to you. After we finish this episode today, I'm going to get in there and respond to anybody that's dropped comments as of yet. But this is for us to help each other as well. Like, I would love to help y'all ease your lives and understand the process and take advantage of the benefits that it does provide to us, because I'm sorry, but it is a great resource, and we are lucky to have such a great resource. And if I can do anything to help you guys ease the system, learn how it works, please let me know. Drop a comment in the comment section. I will get back to you.
Y'all have a great day and stay blessed, and tune in tomorrow for our next episode.